Cardiovascular implantable electronic devices require chronic monitoring for the assessment of normal device electrical parameters and possible complications associated with cardiovascular implantable electronic devices. Based on data collected during the observation period, pacing parameters and/or antiarrhythmic therapy in cardiovascular implantable electronic devices should be optimized. The battery status of the implanted device should also be monitored. According to the recommendations of scientific societies, in the early period after implantation, the device should be checked within 3 days and then between 2 weeks and 3 months. Pacemakers and CRTP devices should then be monitored at least once every 3 to 12 months. At the same time, ICDs or CRT-D devices should be monitored every 3 to 6 months. Part of this maintenance can be performed remotely by means of telemonitoring. Devices can only be checked and programmed through the use of programmers produced by the same manufacturer. Therefore, it is important to determine which company produced them before checking the device. The red arrow indicates the programmer head, which can connect wirelessly with the cardiovascular implantable electronic device. The current slide shows an example of the parameters of a dual-chamber cardiac pacemaker. The programmer's screen shows options for changing the pacing mode, lower rate, and atrioventricular delay after a paced and spontaneously sensed atrial event. We can also use the programmer to change the amplitude and width of the pacing impulses, as well as the polarity of pacing and sensing in the atrial and ventricular channels. Other basic parameters assessed during maintenance of cardiovascular implantable electronic devices include battery status, detection of signals from individual chamber or chambers, so-called sensing, impedance of the lead or leads, as well as pacing thresholds in individual chambers or chamber in the case of a single chamber device. The figure shows the assessment of the pacing threshold in the atrial channel. The AP marker means atrial pacing, while the AS marker indicates atrial sensing. In the context of pacemakers, the pacing threshold means the minimum amplitude of the impulse that must be delivered to the myocardial chamber at a constant duration to induce cardiac chamber electrical activity. The pacing threshold can also be described as the minimum impulse width necessary to pace the cardiac chamber at a constant impulse amplitude. In the presented patient, the atrial pacing threshold is 0.5 volt at 0.3 millisecond. The presented figure is an example of the assessment of the pacing threshold in the ventricular channel. The VP marker means ventricular pacing, while the VS marker indicates ventricular sensing. The examined patient also has a ventricular pacing threshold of 0.5 volt at 0.3 millisecond. These are very good pacing parameters. It should be remembered that a strong electromagnetic field affects the operation of cardiovascular implantable electronic devices. Prior to magnetic resonance imaging studies, it is crucial to refer the patient for implanted device reprogramming. Such proceedings may also be justified before some surgical procedures. Possible complications associated with cardiovascular implantable electronic devices include pneumothorax, pleural hematoma, pain in the device packet, perforation of the heart, and venous thrombosis. Infections of implanted devices comprise another serious complication of electrotherapy. Unfortunately, these are generally associated with the need for complete removal of the device. In summary, cardiovascular implantable electronic devices play an important role in modern cardiology. They improve the quality of life and/or reduce the mortality rate associated with sudden cardiac death resulting from arrhythmias. It is important to know the indications for implantation of cardiovascular implantable electronic devices to optimize patients' management. Knowledge of the basic principles of cardiovascular implantable electronic devices and how they function is crucial in the care of patients after their implantation. I encourage you to familiarize yourself with the relevant sections of the current guidelines of the European Society of Cardiology. Soon after graduation, guidelines from various scientific societies will be the basic source of knowledge for you. For those particularly interested, I recommend reading specialty journals such as Polish Heart Journal, Journal of Rare Cardiovascular Diseases, and European Heart Journal. Thank you very much for your attention. If you have any questions, please do not hesitate to contact me via my email address.